On top of that is insomnia, which could be transient or intermittent and chronic in nature. Then sleep breathing disorders, which include snoring and sleep apneas. And then I'm going to talk a little bit about movement disorder, including restless leg syndrome and periodic limb movement syndrome. And then some disorders like hypersomnia, which could be idiopathic, or on extreme, it could be narcolepsy. The certain disorder which are related to sleep timing, and it is primarily a circadian rhythm issues, which could include your delayed sleep phase syndrome, like people, youngster, and people like Karachi. I think everybody has delayed sleep phase syndrome. People do not go to bed till 3 o'clock in the morning. That's a very strange phenomenon. Advanced sleep phase syndrome, mostly seen in the elderly population. They go to bed very early and wake up very early. Jet lag, people like me who are traveling from different time zone, because of the change in the circadian rhythm and the timing, your sleep cycle gets disturbed and usually takes time to get adjusted into the new time zone. Sunday insomnia also has a factor in terms of our sleep habit. Shift work sleep disorders. People who work a different shift, third shift or middle shift, they sleep during the daytime and work at night, and that could, in some people, causes problem to get a quality sleep. And seasonal affective disorder also has an impact on our sleep well-being. Now, briefly about insomnia. People with insomnia may have significant trouble falling asleep. Many wakes up during the night and difficulty to going back to sleep. They also have daytime drowsiness and sleepiness, and it's a common problem. During the daytime, people who have insomnia, they tend to show some anxious and irritable behavior. They are forgetful, and they have difficulty in concentration. So, huge impact, and all these things is because of lack of good quality sleep. As I said, there are different types of insomnia. Transient, anybody could have transient insomnia, which usually does not last more than 2 weeks duration. One could also have intermittent insomnia, which is basically a repeated episode of transient insomnia. But the story is totally different when somebody develops chronic insomnia, which is more than 6 month duration, and it should be treated with respect. Throwing medication is not the key for success. Common drugs which can cause insomnia include alcohol, caffeine, chocolate, nicotine, beta blockers, calcium channel blocker, bronchodilator therapy, corticosteroid, your decongestant, which is commonly used in nasal congestion, antidepressant medication, thyroid hormone replacement therapy, anticonvulsant, and other high blood pressure medications. So all these medication has some role in terms of disturbing our quality sleep. So when you prescribe these medications and somebody is having a problem, one has to keep this thing in mind and reassess the patient's situation, and may need some adjustment in the medication to obtain your objective of good quality sleep, and also continue to treat their underlying medical conditions. As I said, the sleeping pills are most common treatment approach, but it causes drowsiness subsequently because the half-life of the medication may be much longer than your total sleep time. It is not a good treatment again for chronic insomnia. It is effective for short-term treatment. The problem with the sleeping pills is that you develop tolerance and dependency, especially with habit-forming medication. Withdrawal can happen, rebound can happen, relapse may occur. but it's commonly used, unfortunately, despite of all these things. And 5 to 10% of adults use benzodiazepine in the past year in the sleep aid. That is a fact. About 10 to 20% of those who are above the age 65 years old, and you know that if you use a medication which has a prolonged half-life and causes drowsiness, especially in elderly population, you may have problem into some kind of medication-related accident, and then deal with all other consequences, including traumas, fractures, and so on and so forth. Non-drug treatment for chronic insomnia is the key for success. Most commonly used methodology is the cognitive behavior therapy. You talk to your psychologist or psychiatrist and get help from them if you have a difficult patient with insomnia. Stimulus control, cognitive therapy, sleep restriction sometimes, relaxing training, and sleep hygiene, the thing which I discussed earlier, how to promote good quality sleep. Combination of all these things should be considered in the treatment of chronic insomnia. Now let's talk a little bit about the movement disorder. There are movement disorders including restless leg syndrome and PLMS. I will talk about that later. What is restless leg syndrome? Well, it's a difficult condition in which people usually feel uncomfortable feeling in their legs just before falling asleep. It is not a pain, it is not only cramp, it could be anything. It could be just an ache, it could be just a tension that in legs. Some people describe it as creepy, crawly feeling, and some describe as that look like a soda water is going in the veins of the person who is suffering from this condition. And mostly happen just prior to falling asleep or you're at bedtime. And sometimes people have to get up and walk around and move their legs to feel comfortable. Restless leg syndrome has some genetic predisposition. Some iron deficiency and vitamin deficiency has been implicated pregnancy. About 20% of the pregnant women may have restless leg syndrome. Unless you ask, they may not be able to tell you about that. End-stage renal disease is also is a cause for that, and neuropathy. So when you are dealing with these patients, take a good history, see what's there, and then try to treat that condition. If somebody has low iron because of whatever reason, try to find out the cause by doing the serum iron testing, especially the ferritin is the more sensitive. And if you have ferritin level less than 50, that iron replacement therapy should be initiated. Some medication has a very significant and important role in terms of treatment of restless leg syndrome. Now the most commonly used medication are dopamine direct agonist. In the past we used to use Cenemet Parkinson medication, and it also has good success, but now the dopaminergic agonist as a first-line therapy. Some anti-epileptic medication could also be used for the treatment. Benzodiazepine, especially the Klonopin, could also be helpful and useful in terms of treatment of RLS, especially people who also have insomnia. This could be a good choice. And then if nothing worked, then the opiates have been used to make it comfortable and relieve the symptoms. Periodic limb movement syndrome, usually diagnosed during sleep study. Restless leg is often accompanied by the periodic limb movement syndrome, but there are a huge number of periodic limb movement, but not everybody with periodic limb movement syndrome has restless leg syndrome. What is periodic limb movement syndrome? It's basically a jerky movement which is coming during the sleep in a succession of 4 in a row between 5 to 9